Last week, we talked about risk factors of getting testicular cancer. The undescended testicle is one of the reasons why. The second one is frequent problems with microlithiasis. And the third one actually is infertilities are the people who are more at risk of getting testicular cancer. In general, it is not really related to genetics. However, men who has got Down syndrome and Klinefelter are more at risk. So how do they present usually? So men with undescended testicle are often asked to do self-examination. If they notice that the testicle is nodular in appearance, just like your knuckles, then there's something is wrong with it. The other telltale sign is that it is completely painless. When a painless lump in the testicle presents in a young man, interestingly, between age of 15 to 38, these young men are more at risk of getting testicular cancer. So what are the ways to make the diagnosis? In fact, most of the time, a doctor doing examination will have an inclination to know that this is testicular cancer because most of the time it's irregular and also it's completely painless. The additional thing that we can do will be something that is called an ultrasound scan of the scrotum. The appearance of the testicular cancer itself is heterogeneous, and then it also is quite classic of two different types of cancer. One is called seminoma, the other one is called non-seminomatous germ cell tumor, or sometimes referred as teratoma. And all these will be telltale sign of something is wrong with the testicle. In addition to clinical examination and also ultrasound scan, there's another thing that we can do is the blood test. The blood test itself is called a tumor marker, and we will look at tumor markers such as alpha fetoprotein and beta HCG. Sometimes you were wondering, beta HCG, isn't that related to pregnancy test? Yes, it is. It's exactly what the pregnancy test shows, that when a woman is pregnant, they produce beta HCG. When a man clearly is not pregnant but has got beta HCG showing a positive pregnancy test, this person has got testicular cancer. So all these three tests will come to a conclusion whether there is a testicular cancer, and more elaborate tests such as CT scan will show the extent of the cancer, whether it's stage 1, 2, or 3, or 4. For the following week, we're going to talk about surgery. The surgery to remove the testicle is called orchidectomy. When they remove the testicle for the purpose of cancer, it's called radical orchidectomy. If you're interested or you're quite fearful of what we actually do in order to cure a patient of testicular cancer, you need to stay tuned for next week's Putting Dr. G on the Spot.